The following is a presentation of Muddy River News.
It's feeling kind of like summer in fall. Does that mean we don't have fall allergies?
No, that means we're probably going to have a more of extended season of fall allergies. The growing season this year has been very robust, and then when that happens, everything has to eventually pass away, and that's when molds start to take over, and you get a combination of mold by way of harvest, as well as mold kind of attacking the grasses and weeds as things go away in preparation for winter. So you really get an extended time frame of growth, and then we haven't seen any frosting yet here. I mean, it may not occur for another little while yet. So until it frosts a couple times, the plants will still keep growing and doing their thing basically with pollen. So
how can you protect yourself without resorting to medications? Is there any way to avoid exposure?
Sure. So the couple of things I always like to recommend in terms of avoidance, I always like to start with avoidance when we treat allergies. The first thing would be to avoid keeping your windows open at night. So keep your windows closed at nighttime. Pollen tends to rise in the early morning hours, so between the hours of about 5 and 9 a.m. And then there's a smaller peak in pollen in the atmosphere in the evening, kind of dusk hours, if you will. But really keeping your windows closed overnight, even though it's tempting to leave them open when the weather starts cooling down, keeping them closed will keep the pollen outside and keep you on the inside a little bit better. Also, avoiding hanging your clothes on the line outside. That collects pollen really well in September and October, so drying them in a dryer is better during the pollen seasons in particular. So those are two things I like to tell people about. Pets bring in pollen, pets bring in all kinds of things as well from the outdoors. That's a little more difficult to control, but certainly keeping windows closed at night, very important.
In terms of over-the-counter medications, the minute you start feeling maybe scratchy throat, watery eyes, is there something that I can take real easy without having to go to the doctor?
Sure. So there's lots of options over the counter. You'll go to the allergy aisle and you're going to be confronted with a lot of different products, but there's really only a few that are necessary, quite honestly, for allergies. That would be your antihistamines. So antihistamines like Zyrtec, Allegra, Claritin, they're going to help you with sneezing and itching type symptoms. And then you've got more nasal spray options. So the nasal spray, specifically like a nasal steroid, Flonase, Nasacort, Rhinocort. There's a bunch of different ones, but again, there's only a handful of agents or generic steroid options that are available. So they all come in trade name and generic, but basically if you start using a nasal steroid spray like that every day, that'll help you more with congestion and drainage.
When do I need to see the doctor?
So most people can get by with from the sneezing and itching type symptoms and a little bit of mucus even, but it's when they cannot breathe through their nose anymore, when they're very congested, they can't breathe through their nose, and when the nose is not working, sometimes the lungs start to give out a little bit of asthma-like symptoms with cough, wheeze, chest tightness, and that's when you would definitely want to go see your doctor or consider getting it handled more on a more permanent basis. So inability to breathe, that's usually when the over-the-counter stuff becomes less effective.
How do I know if it's allergies or the cold or the flu or something more serious like RSV?
Sure. So typically in patients who have a history of allergies, they kind of know what to expect this time of the year. It's very predictable. A lot of those folks have had a history of allergies most of their lifetime since childhood. So if you're just now all of a sudden getting sick, and especially with low-grade fever, a lot of green mucus, feeling totally run down, and that's kind of unusual for you, then it's more likely to be a virus. RSV season, that's still the peak of that is going to be coming up later on in a couple months, but that's going to be more younger kids, but also older kids as well with wheezing respiratory tract illness during those typical winter time frames.
Muddy River News. Our home, our news.